I'm Ali Peterson. I'm a family nurse practitioner and a nurse midwife here at CCM Health. I've been here since September of 2022. Here at CCM Health, we have two midwives, Jane Reed and myself. This fall, Jenna Erickson is going to be joining us as a third midwife to add to our team. Care under a midwife is comprehensive. It's really patient-centered, and we try to meet the needs of our patients by asking the patient what's important to them and having them really drive their health care. We come in with our medical knowledge and all of the resources to surround the patient with, but at the end of the day, we want to really make sure that our patients feel heard, they feel understood, and they feel well cared for. Our team here at CCM Health offers waterbirth, and I would say one of the biggest benefits to having a waterbirth is the amount of movement that you can have during the second stage of labor. Oftentimes, when women are in the second stage of labor and in the pushing phase, they feel so heavy, and the pressure is very intense. And I think that water in general can just lift a little bit of that pressure sensation and allow your body to move more freely, and it also allows women to really listen to their body and push how it feels most effective for them. Movement in pregnancy really starts in the prenatal period. We do a lot to educate our patients about correct posture and stretching, the importance of taking walks and staying physically active during pregnancy. When we do that prenatally, it really helps babies come into a better position within the pelvis, and it does make for a little bit of an easier transition into the earlier stages of labor and birth. During the labor and the birth period, same thing, positions really are important. We pay a lot of attention to the mom's movement as the baby is moving through the pelvis. And so there's three parts to the pelvis. There's the inlet, the mid-pelvis, and the outlet. And depending on where the baby is at moving through the pelvis, we really try to get mom in the most optimal position to allow those cardinal movements of birth to happen. I think that when a woman chooses CCM Health for her health care and for the health care of her family, because women do make 90% of healthcare decisions for their families, I think that what's unique about our organization is that our providers, both as family practice providers and as nurse midwives, we really try to look at the mom and the baby as a unit. And so I think that you'd find that with our care, we're addressing both mom's needs and baby's needs together, as opposed to other models of care where the obstetrics is siloed away from the pediatrics. We know that moms do better when their babies do better, and babies do better when their moms do better. Currently at CCM Health, we use hydrotherapy in a number of forms. We know that water in general is just so soothing and therapeutic to women in labor. And so in our LDPR rooms, our labor, delivery, and postpartum rooms, we have jacuzzi tubs. Women can spend time laboring in them. And then as they get closer to the time when their babies will be born, we bring them into this room where we have our inflatable waterbirth tub, which has been a really great option and helped to grow the service here at CCM Health. We are having so much demand for waterbirth that we're actually going to install a stationary built-in tub. So women are going to have the ability to labor in the same tub that they give birth in. And I think it's going to be a really nice addition to the service we provide. If somebody asked me why to choose CCM Health for their obstetrical services, I would tell them that you would be choosing a team of people who really care about you and want you to have the best experience and outcome possible. I just think that the team is second to none, and we do our best for our patients every day. I am so proud to work in the OB department at CCM Health. First and foremost for my patients, I'm just so proud of my patients and watching them prenatally and then through their labor and delivery and the postpartum period. Women really grow when they go through the experience of becoming a mother every time, even for moms who already have children. Every Every new pregnancy and every new birth experience really just adds to the richness and the fullness of our life. And it's a pleasure for me to be a part of that. I'm also incredibly proud to just be a part of this awesome team. It's a really cohesive group of nurses and midwives and physicians and OBGYNs. And I think that you'll find there's a pretty special hometown feel to the care that you get here.